So do you want to be a CRNA or do you want to be a nurse practitioner? How do you know? How can you figure out what the right career path for you is? Howdy YouTube family, it is Bolt CRNA coming to you with another day's topic. So today we're going to be talking about, should you be a CRNA or should you be an NP? Do you know what the differences are here? And how do you figure out what the right career for you is? We're going to get into that today. This is a common debate. A lot of people who are NPs thought about being CRNAs. A lot of people who are CRNAs have thought about being an NP. And there are some people who are both an NP and a CRNA and have both degrees and both educations and licensures. So there's a lot of intermingling here. Let's talk about why one is different than another and how can you kind of figure out what is the right one for you. The first and most important thing that you're going to have to do is you're going to really need to shadow both of these roles. There's going to be nothing you're going to read online or hear from a YouTube video that's going to be more valuable than firsthand experiencing when you follow along with the nurse practitioner all day and see what a typical day as a nurse practitioner looks like, feels like, the struggles they face, the triumphs they face, things like that. The general workflow of what they're dealing with, the patient interactions, and you getting an idea of, is this something that I could see myself doing every day? Is this what speaks to me? Am I excited and invigorated by this? And then at the same time, I would go follow a CRNA and do a shadowing experience with a CRNA and see what their day typically looks like. You want to, of course, make sure that with both of these professions that you're seeing a typical normal day and you're seeing an average normal experience. You don't want to do an outlier, unusual specialty type position and see that position, because that's not going to give you a good idea what the general person in that role is going to be doing. So yeah, in general, you want to see like what a run-of-the-mill typical day looks like for both these roles. And after you've done that, that's going to give you a lot of information about just how you feel about these positions. Of course, talking to people in these roles, talk to nurse practitioners, talk to CRNAs, figure out from them, what do they like about their job? What do they not like about their job? What do they find to be the most rewarding parts of their careers? And what are the most kind of negative parts of their careers that they would change if they could? And sometimes, I mean, most people will be very transparent with you. If they know you're interested in becoming one of these positions, they're going to be transparent to let you know so that you can make the informed decision. No one wants you to make a career choice in something that's not the right call for you. Another good rule of thumb when you're talking about NP versus CRNA is, do you like working more directly with your hands, one-on-one with the patient, creating a plan, doing that plan, seeing the plans to fruition, and then finishing out with that patient and being done? That is kind of the role of the CRNA. That's more of the workflow and kind of the mindset of a CRNA, is not long-term. I'm not managing or keeping up with someone for months at a time. I'm keeping up with one patient for one case at one time, and that's going to be my undivided all attention on this one person. And I'm going to make decisions for that patient. They're probably going to be unconscious, so they're not going to be as involved in the decision making. You'll be mostly the one deciding what to do. You'll be doing it, and then you will be seeing the outcome of what you did, and then you may do something else to counteract it, or, you know, there's lots of different ways that this can kind of cascade into a set of events. But essentially, you mostly will be doing this on your own and very autonomously. And you'll see instant reactions and instant gratification or instant problems that you will have to fix for that problem. So that's kind of the role of CRNA. And then when you're done and you drop them off, the patients are oftentimes groggy and sleepy. You may not even say goodbye to them. If you say goodbye to them, they may not remember it. Those types of interactions and relationships are just a little bit different as a CRNA. As a nurse practitioner, you're going to be in charge of long-term management. You're going to be probably seeing the same patients on a repeat basis. Maybe you see them every month or 2 months. Primary care or even women's health or even psych NPs, they usually see these patients over and over again. A lot of your job is talking, educating. You're not directly doing things hands-on most often with your patients as an NP, besides assessing and discussing with them. And then you are going to expect your patient to hopefully be compliant. You're going to give recommendations, prescriptions, and then you're going to send them on their way. And then hopefully when they go home, they do what you say. Knock on wood that they're compliant. And then they're going to come back and then hopefully their improvement in their pulmonary status or diabetes or whatever it is better. But you know, you deal a lot with patients kind of having to be bought in to what you're saying and doing, and they have to kind of take over a lot of ownership over their own health and wellness, and then you kind of deal with the outcomes later on. So it's not as instant gratification, and it's not as one and done and moving on and no longer, you know, seeing that patient anymore. As an NP, often you'll see them over and over, you know, long term. Another thing to remember is education-wise, the education is different. The education for a CRNA is very specific. It's very dialed into the sciences, very specific on skills, anesthesia-related topics, and how health and pathophysiology and what's going on with their patients relates into anesthetic management and surgical interventions. So an example would be if you're studying pulmonary COPD, something like that. You're going to be studying it in the context of how you would manage it anesthetically. How are you going to manage a COPD patient who needs a gallbladder removed? You're going to have to intubate that patient. What kind of problems or complications would be you think about with these types of patients? Whereas if you're studying COPD as a nurse practitioner, you're going to be looking much more at just the management of COPD, long-term management, sending patients home with what types of inhalers, what types of ways and treatments and you know, pulmonary therapy and things like that. So it's just different from the perspective of how you're learning these things and the approach. Another thing to remember education-wise is as an NP, you can still get your master's degree as an NP. You have to have a doctorate as a CRNA. So you have to be okay with doing doctoral education coursework. That's going to be the requirement for a CRNA. The other thing to remember is CRNA school requires quite a few different things like ICU experience and certifications and an interview process that can be very rigorous and difficult to get in. A lot of different science courses that are specifics that you have to take and score pretty well in from your undergrad. And if you don't have those things, sometimes it takes a year or two or more of prepping yourself to get your application together to be able to get into CRNA school. Nurse practitioner school doesn't require most of those things. So a lot of times people can get in a lot faster and it's not as many benchmarks you have to meet. Another thing to consider when you're talking about NP versus CRNA school is the cost. Of course, with a master's degree as an NP, it's going to be cheaper than a doctorate degree as a CRNA. In general, your education is going to be cheaper. Another thing to remember is most nurse practitioner students work at least part-time, if not full-time, throughout most of their program while they're doing their education. It's a lot more manageable to do the coursework at home or on the weekends and then also working. Of course, they're very busy, and I have NP friends who told me like it's quite busy for them to do this. It's not a cakewalk, but it's manageable. For CRNA school, it's pretty much impossible. You're not going to be able to work any significant hours, if any at all, in CRNA school. So you're probably going to go 3 years of no work as a CRNA student, meaning you're taking on student loan debt just to live. And then on top of that, you're paying a pretty high level of tuition, maybe $90,000 to $100,000+ in tuition alone, on top of the money you're going to have to live on for 3 years while you're not working. So your debt is going to be pretty significantly high, maybe $250,000 when you graduate from CRNA school. Whereas in NPs, it's much less than that. And then finally, you also need to decide what kind of income are you comfortable with when you get out of school. So you've decided that you like a certain type of workflow and you like the educational requirements of one versus another, but what do you need to live off of when you graduate? Of course, it's a job at the end of the day, and people expect to get paid and live off their incomes. So you need to make sure, are you comfortable with the income level? The U.S. Bureau of Labor Statistics said that last year, nurse practitioners made $126K per year. That's on average. Of course, some people will make more, some people will make a little bit less than that, but the national average altogether is 126. As CRNAs last year, they quoted them at 214,000. So you're going to, of course, make a lot more as a CRNA. The income is going to be better. Of course, the student loan debt is a lot higher, and the stress level, some would say, is a lot higher in this kind of role. So you just have to decide which kind of income are you looking for, and what are you comfortable living with. You need to enjoy what you're doing every day. So that really trumps it all, whether you're getting paid 126 or 214. If you don't love what you're doing every day, it won't matter. You're going to be miserable. So don't choose based off of income alone, but it is important to understand what are you going to get paid and your compensation for this type of role. All right, guys, so that is everything about nurse practitioner or CRNA, which is the right one for you. I want to hear down in the comments below from nurse practitioners, CRNAs, nurses who are choosing one path or the other. Why are you picking one or the other? And did I get everything correct here? Is there something that you feel like I should have focused more on? Or is there something that I didn't say at all that you were like, hey, this is a really important point? I want to hear from you down below. Of course, follow me over on Instagram. It's both CRNA. That's where I'm most active. I also have TikTok. It's both CRNA there too. And then don't forget to hit the like button and the subscribe button. I really appreciate that, guys. And I will see you next time. Let's bolt out.